Okay, greetings, and I'm going to call this one surplus to requirement. This morning, 7th of May 2020, woke up to the news on the BBC that people racialized as black are some 90% more likely to die from Covid-19 than Europeans.
Our headline findings are just under twice as likely for the black group, and then about 70% more likely for the Bangladeshi Pakistani group, and about 30% more likely for the Indian group compared to the white group.
Now, for many people, those headlines would have been pretty confusing. Now, the ONS is the Office for National Statistics, and their research was saying that we were 90% more likely, whereas before we'd seen things saying that we were 4 times more likely. And all that really happened was that the ONS had actually done an amalgamation of not just age, but they were looking at all underlying factors drawn from census data, and that's how they reached this conclusion.
Okay, a lot of data to take on board, some really interesting findings, which people, of course, can go to the ONS website and Twitter account to find out more about. That's Nick Stripe, the head of health analysis at the Office for National Statistics. Thank you very much.
On the day that this broke, what were the headlines of the major newspapers? Well, some nonsense about lockdown being eased. You'd think with a figure like this, with a headline like this, with raw data from the body that provides the government with its data, the more accurate data that it uses, you'd think that there'd be a bit more focus on this. But there wasn't.
Well, let's get some reaction to all of that with Dr. Bharat Pankhania, who's an expert in communicable diseases at the University of Exeter. Very good to have you with us again. Does what Nick Stripe from the ONS has just been saying, does that back up what you have suspected, believed in relation to COVID-19 deaths and ethnic background?
Yes, and thank you for inviting me. This is really good work by the Office for National Statistics, and we are very grateful to them for doing this so quickly. Now that this great big red flag has been raised, that the ethnic minorities, black, Asian, minority, ethnic people have got an added risk, we must do something about it immediately.
Now, the government has already been asked during its daily briefings about what it's going to do. And first time Matt Hancock, because Boris Johnson is once again doing a sickie. This part-time Prime Minister who's just never there has decided that they're going to kick this into the long grass. They're not going to take any action. And so their response was pretty tepid, as you can imagine.
What is being done to ensure that BAME key workers are not disproportionately affected by COVID-19?
Thank you, Saqlain. An incredibly important question, but what I'd say absolutely from the start is that we recognise that there has been a disproportionately high number of people from black and ethnic minority backgrounds who have passed away, especially amongst care workers and those in the NHS. And I think it's affected a lot of us working on it to see that. And so we've got a lot of work going in to fully understand scientifically and make sure that in every single case we learn what we can to protect people better.
I'm not one who really likes to be scaremongering, but I think this is quite important information, and I can't say this enough, that something has to be done.
On the subject of the signal that we have so far on black and minority ethnic groups, I want to say to you that we are taking it incredibly seriously. There is a very big piece of scientific work now ongoing that will report to the Chief Medical Officer, and we'll get to the bottom of this, however long it takes us. But I will also say that this is a complicated picture, because when you start to study patterns of disease across different ethnic groups, you also have to take into account potential differences in the age structure between groups, also differences in the patterns of underlying medical conditions, which we know do vary by ethnic group, and therefore it's a complicated picture.
It's a complex picture, but some of that picture we've known for some time. It's not a mystery. And it's, I suppose it's a tragic episode in a systemic failure, and we have to deal with it systemically.
Tackling those systemic failings will, of course, take years. In the meantime, the death toll keeps on rising.
Well, just to say that we are, as you say, looking at the data very carefully, not just on ethnicity, but also on age, sex, and other factors such as obesity, which we know do have an impact on the effect of coronavirus. But it's already clear from some of the published data that the impact in BME groups is greater, that there are more people with the infection, and those who have the infection have worse outcomes in many cases.
And again, today at the daily briefing, the government was asked once again, what are you going to do? Because of course now we have raw data, we have more information. They always say that they're being guided by the science. You'd expect something to happen, right? Some change to take place, but no, once again, kicked into the long grass.
The government said it's looking into it. Are you actually going to do something about it to protect, for example, frontline workers from these ethnic groups?
Well, look, first of all, we're very concerned about it. It's something we take very seriously. We're learning more about this virus all the time because it's new. And we've asked Public Health England to look very carefully at all of the implications and how it is affecting different communities, but particularly the BME community. And once we've got the advice back from them, we'll know what interventions can sensibly be made. And that's the way, again, as we've said throughout, we need the scientific evidence to back up any policy decisions that we would want to make in that front.
In the last few days, we've had 3 new pieces of research about the increased risk to BAME communities from coronavirus. The figures have been sobering. So is it now time for a shift in policy towards frontline workers so that we can protect certain groups? There's a concern that there could be a delay because the government has commissioned its own research, which may yet take another month to report back.
While the review and understanding the data is essential, we shouldn't use that as a reason for not taking action now.
Now, in the meantime, we have newspapers like the Telegraph accusing us of victimhood. And, you know, that little rag is, I don't even think I should even dignify that with a response.
And just to follow up on Libby's question, should BAME people now be shielding as they are potentially more vulnerable and at greater risk of catching and dying from coronavirus?
Well, in relation to the BME question, we'll take decisions as policymakers when we've got clear advice from PHE on the causes and the implications and what we could responsibly do. I think that's the responsible thing for ministers to do.
So anyway, over the last few days, I've written to many of the institutions that are responsible for frontline care. So I'm talking about Public Health England, I've written to the NHS and the Equalities and Human Rights Commission. And in each of these cases, when I do get responses back, they're all saying the same thing, that they're guided by Public Health England. And so the NHS website was not including ethnicity as something that makes people vulnerable, even though we know the data says that it does.
What do you think should be done about this? What measures can be introduced to try to get rid of this differential so that people from these ethnic backgrounds have as much of a chance of actually fighting this disease as someone of white ethnicity?
In the first instance, we must pull them out of frontline and deploy them with telephone consultations or extra PPE.
What would you expect the government to do about this, and what would you expect them to do practically and quickly, presumably?
Yes, indeed. So now that this information is available and it is clearly indicating that there is an extra risk, we've got to act immediately, meaning like today.
Anyway, I don't want to make this video too long, so I've got a really simple message. You see, there's a really good quote from Malcolm X, and it says, it doesn't take a man to fight for freedom. It just takes someone with some intelligence. And so that's why I'm saying to you right now, if you are on the front line and you are at increased risk of contracting this virus, then please don't wait for your managers to wait for a government inquiry, to wait for them to dither and decide to actually protect you, to shield you after they've actually released a lockdown. what you need to do is go to your employer, go to your manager, whoever it is, and say to them, demand them, I need you to redeploy me now. The statistics, the evidence has told you that I'm more risk. And so I need you to show duty of care to me, my family, my community, because that's who it will spread to. This is not an unreasonable request. Anyway, I'm going to sign off now. I'm still a bit pissed off about the passing of a friend of mine, Ty. So I dedicate this video to him. Also, Ahmad in the US, the African-American jogger that was murdered. It really feels like our lives are just treated as if they're disposable. We are not surplus to requirement, no matter how many people would like to pretend that we are, because they feel that we are economically inactive, just like those in the care home. Anyway, may the ancestors continue to guard and protect us. Asher.